the doctor is in. Paul Wallace, MD, is here. He's overseeing the operation of Wallace of Beverly Hills since 1993. He's got a lot of other kinds of experience as a doctor, one of the top fight doctors in the world. He was also in the Army and did doctoring there, too. That sounded real official. Dr. Paul Wallace, good morning.
Good morning, Dominique. Good morning, family. How are you?
All is well. How are you doing?
Well, I can't do better this morning. I mean, how great of a time and what a great honor to be able to be on so that Stephen Hardaway Moore can say happy birthday to the brother.
Indeed. I know you're a doctor who's also a music aficionado, so I'm sure it's quite heartfelt.
Oh, absolutely. Absolutely. And, you know, I think that in your previous conversation, it was so impactful. It sounded like I was listening to myself, talking about the water, talking about the power of the mind. Mental health is far greater than what I can provide to individuals. And sometimes I help to just steer them along the way. But I say that because I can think of the decades that I've depended upon Stevie's music to help me get through the best of times and the worst of times, and it's always come through. Whether I'm singling in on a particular album or a song, I can absolutely say that, as I would say to the audience today, I just called to say I love you, and I want to help you love yourself more.
And we're taking your phone calls. I mean, look, this COVID-19 thing is a medical emergency, and we've been doing a lot of talking around a lot of other things that are going on, you know, reopening and in the election and lots of stuff. But we had some folks request that I have more doctors on where they can really get a chance to talk directly with a doctor, and you are here for that. So 520-KJLH, 520-5554. That's the number. No matter your area code, you can talk to Dr. Paul Wallace. Dr. Wallace, when you were in the Army, you also worked on some epidemiological pieces as well, right?
Yeah, that's right. I spent a significant period of time. We were working on a malaria vaccine, and there were stations all over the world, in Korea. I spent time in Kenya. And so talking about the epidemiologic part of it, and, you know, without getting that part there, but how do you trace, how do you track what happens? And you can just imagine, and I've mentioned it before, it's sort of like the game of tag. So somebody's it, and then they go and touch somebody else, and they're it. But instead of it's not freeze tag, what happens is all of these people get infected. Well, you can get in front of that and figure out who are all the people that they came in contact with. And yes, it always seems as though that you're behind the eight ball, but you can catch up. And we've been through these things before, whether it's been smallpox or whether it's been polio. We've seen this before. Your parents, your grandparents, your great-grandparents have gone through this and been successful and made it because that's how you're around. So, yeah, there's a lot of things that are going on right now. Things are starting to reopen, but that doesn't mean that you, by any means, think that you don't need to practice safe, healthy habits. The hand washing is still necessary. The masks are absolutely necessary because you want to minimize your risk in being able to contract the virus.
All right, we got a bunch of people on the phone that want to talk to you. Also, when we get back, I want to get your take on, you know, now they're saying you could get COVID-19 through your eyes. Want to get your take on the whole 5G controversy. All that's coming up. It's the front page. It's a Wellness Wednesday. Dr. Paul Wallace, the doctor, is in. We are broadcasting live from the KJLH 1-800 The Law 2 studio, Radio Free 102.3 KJLH. It's the front page. Radio Freedom. We've got it. That means you've got it too. We play what we want. We say what we want. Black owned and unapologetically so. Happy birthday, Stevie Wonder. We're talking with Dr. Paul Wallace, MD, on a Wellness Wednesday. And we're going to go right to our phones. Dr. Wallace, if that's okay with you. D.A. from L.A., thanks for your patience. You are on the air.
Hey, Jumbo. Everybody.
Jumbo.
Hey, did you get the Swahili for happy birthday?
Oh, no, not yet. Darn it.
Shoot.
I should know that. I think we've done it before. Let me look it up right now. Okay, you say what you say while I look up Swahili for happy birthday.
Well, I got a gift for the family and of health. I got a gift for you. And also, I wanted to know if Stevie Wonder got, and Dominique, did you get my gift from my T-shirt? Everybody, you don't have to shake hands anymore. My T-shirt.
Oh, not yet, but, we're working from home, so I wouldn't have seen it yet if you sent it to the station. Everybody's socially distancing except for our radio first responders, the folks like Bobo who have to stay in there and keep everything running.
Well, it's there with your name on. I'm sorry you didn't get it.
Okay, well, I'll stop by and look for it when no one's there.
Okay.
Here it is. Siku, by the way, thank you for that. But here it is. It's long. Siku ya kuzaliwa njema. No, I didn't know that. Siku ya kuzaliwa njema. Stevie Wonder.
Okay. Well, my gift for the family is a gift of health because I've been shut in for 2 months and I started drinking a little bit more than I was supposed to, and I got the gout. I get it.
No.
Yes, ma'am. Got the gout. But through health and alternative medicine, I learned how to get rid of it. And I have to go there, spend a whole lot of money. All you got to do is go down to Simply Wholesome's, recycling black dollars. And I went and got my black cherry juice, got my enzymes, got my water. And you can't get celery from there. They don't sell that. But I went to Ralph's, got some celery. And that's it. And I flushed my acid out of my body in 3 days, and I'm up and walking again. The inflammation gone, pain gone, and I'm on the good foot.
And you had to also make sure you cut down on your meat, right? Cut down on nuts and things like that. You change your diet a little. Congratulations to you. I love it when we take our wellness into our own hands. Dr. Wallace, you got something to say? This man fighting, and I imagine a lot of people, whatever their chronic conditions are maybe acting up while we're in the stay-at-home orders, right?
It is, and I see a number of my patients that have problems like eczema or atopic dermatitis or psoriasis. They're having flare-ups because there is a huge emotional impact of what we're going through right now, and it often shows up in the disease process. Well, one of the things that I always try to press is that don't become the disease. Don't become whatever problem you have. It does not define you. So as you think, things will happen. I did a small part in helping bring someone to better health, but the biggest part is in your own mind. And don't allow your mind to go down a negative pathway. Think positive and do something. It can't all be sitting around and thinking about it. You need to do something healthy, as they were talking before about doing your exercise, drinking your water, and get active and be self-empowered to go beyond what may be limiting you physically.
All right. And DA, are you still there?
Yes, ma'am.
So DA was talking about his gout. You got anything to add? It sounds like he's doing all the right things, drinking water, eating celery, taking his herbs, changing his diet. Would you add anything, Dr. Wallace?
No, I think doing the right thing will get you right where you need to be, and that is excellent. Again, the self-empowerment, you take over. You don't allow the disease to take over you.
Well, I would think that it would be a great section for people to start calling in with home remedies. So,
yeah, I love that. I love that. Home remedies and happy birthdays. And you know what else, DA? I think that when you do the things, when we have something we have to overcome, like many years ago when I was diagnosed with diabetes and I just went full on holistic with Dr. Rab, it helps a lot of other problems that you have or might be getting ready to have. So it's not like, a punishment. It's like you are forced to do what everyone should be doing anyway.
Oh, well, quite frankly, when you start doing what I did, or you do alternative medicines, it doesn't just take care of the gout. It's taking care of a lot of other things that are in my body. So it's not one thing cure all. It's cure, but it does kind of cure all. You know what I'm saying?
Yeah, absolutely. Well, congratulations to you, DA.
And happy birthday to you, Stevie. I love you. Love KJLH. Thank you for that gift.
Much appreciated. Charles from 1-800-UNITE-US. It's all about you.
All right. Well, first of all, I want to say happy birthday to Stevie Wonder. And
Indeed.
Just want to thank him for this wonderful, wonderful station. Just think how many of us had a chance to meet and communicate over the years because of Stevie Wonder and KJLH. So just thank you to the KJLH family and all the listeners. And it's just it's one of the best things about LA. All right. Now to my point. We were talking about the economic stress, which leads to physical stress, which can lead to hurting the immune system and making it easier for that COVID to take your life. So there's two things we can deal with to limit economic stress. One is to buy black. These are things we can do today. We can buy black today. We can also call Congress and ask them to support that bill that would that they would send $2,000 a month to just about every American for 6 months. Kamala Harris and Bernie Sanders, they just sponsored a bill on the Senate side. Unfortunately, Congresswoman Pelosi, Speaker Pelosi, wants a bill to pass another one-time $1,200 a month, just a one-time $1,200 a month for the peasants, and that's not going to get it. So I would encourage everybody to exercise their fingers and contact Pelosi and say no to the $1,200 one time and yes to $2,000 a month. That would relieve a lot of economic stress.
All right, Charles, thanks for that. Dr. Wallace, you want to piggyback on what Charles from 1-800-UNITE-US is saying about stress? I mean, because you just mentioned how that can exacerbate, anything from a skin condition to a cancer.
It absolutely does. And the power of the mind is certainly the ultimate power. And being able to control that and understand when you are going a bit too far. And it's a natural for us to try to link the dots. We don't like, as just humans, we don't like the unknown, and we'll grab on anything that seems to have a pattern to it and say, this is the reason. Sometimes we don't know. And I can tell you that as a physician, there's many times when I don't know. But I do know some of the things. And like was mentioned earlier, we have a lot of home remedies that have worked for decades, centuries. And most of the problems that we have, whether it be diabetes or gout, are all inflammatory problems. Your body is inflamed. One of the things that water does is it's an anti-inflammatory. One of the things that rest and sleep do are anti-inflammatory. Eating things that aren't packaged, eating fresh vegetables and all move towards anti-inflammatory. You'll feel better, you'll look better, you'll sleep better. All of your bodily functions will be better. And these are things, Dominique, that we know. They don't cost much money. In fact, they cost less money than to do something bad to your body or put something into your body. So if we practice these and we do our exercise, we'll also emotionally start moving into a positive place. Small goals each day. And you may not be able to do the 10,000. I thought that was an excellent program. But if you're doing none, let's start off at 100. Or let's start off at 50. But let's start. Don't wait for something to happen. You have to be actively involved mentally and physically.
Absolutely. Thank you for that, Charles from 1-800-UNITE. So I saw an article this week that was really helpful in terms of how do you catch COVID-19? Because as people start to reopen, right, when we start doing more things, or in some cases, it's like what we see in Georgia where they're reopened and a lot of folks are not going to do more things because they're just like, heck no, I'm not getting sick. The questions become, more pressing about how do you get this? How do you catch it as it would, as it were. And one of the things that there's just a lot of misinformation going around. It seems like when it first came out, there was mostly talk about touching surfaces, right? And how this COVID can linger on surfaces. Now there's a lot more conversation about it being in the air. Not that it's traditionally necessarily airborne, but that those droplets or whatever stay in the air, and that's how we get sick. And that conversation is what is outlined in this article, where he's talking about, from what I'm getting from this, that we might really need to look at having either school outside. I mean, I know they can't do that in Wisconsin, but here in California, having more open air classrooms, restaurants, parties, having more air circulation within those enclosed spaces, because it really seems like the biggest danger is from breathing it in or taking it in through your eyes over a sustained period of time. It's not like 1 second, because you have to get a certain amount of that viral load into your system to actually get sick, right?
That's true.
So how does that work? I mean, how would we know when we got too much of a viral load, or what would be the threshold for danger?
Well, we have, again, that when we say, how do you feel? There's time, and let's remove the time frame from the COVID. There will be times when you go out and you say, my throat feels a little scratchy, or you say, I have a headache. That we have signals, and one of the biggest problems, Dominique, that has developed as we become more urban and have not had to rely on ourselves is that we don't listen to the signals of our body. Our body is a fabulous thing, and it tells us all the time, but we've learned how to bypass those. But each of us have had those moments when we say, there's something that just doesn't feel right, and we have the opportunity there to do something for it, whether that, again, is sleeping or more water. We say, how do you tell yourself, gosh, I think I need to eat more vegetables. Your body's talking to you. Listen to it. And again, if you practice the healthy things that you already know, you're going to see the rewards and benefits. The last part, in terms of, yes, this is an airborne disease. It is out. And think about it again, prior to the time when COVID came out and somebody would sneeze, and you feel it across the room or you feel it there. You said, wow. And we see the cartoons of the other of how it goes. It can propel anywhere out, not just 6 feet, but can go longer than that. That's why the masks are so important. And yes, you can get it by touching things, but it's more airborne than anything else. Is the reason why we have these 6 feet of separation. That's usually the more than where the average spray will go if you were to sneeze without covering your mouth at all.
Right. Okay, so this is this article that I was talking to you about. It's really interesting because one of the things that he says is that most people get sick in their own homes. A household member contracts the virus in the community and brings it into the house. And because they're having sustained contact, he's saying that, you have to get 1,000 COVID particles for an infection to take hold. And that usually means, you're having a sustained conversation. You're at a situation where you're going to be breathing in those particles over a period of time, which is why we hear about people at funerals, that choir where most of the whole choir got sick after a 3-hour rehearsal because they're singing. When you're singing, you're pushing out air, which is almost like maybe a miniature sneeze. And so more particles are going into the air and people are breathing them in over a period of time in an enclosed space. That seems to be maybe the most dangerous situation.
And that's one of my greatest fears, because this is not the time, because it's her birthday, anniversary, whatever, it's not the time to go visit grandma. This is not the time for Big Mama to give you a hug or then to see the kids and children. The amount of exposure that you can give for a person who has problems already. They have other medical problems already. Their immune system is down. And if you love them, stay away if you possibly can. Practice the safest methods in terms of if you're going to give something, you're going to take something over, make sure that you wipe off all of the kitchenware, all the containers that you have. Help them help themselves. Don't subject them to a large amount of the viral load, because remember that you are contagious before you might even feel it. So that's what they mean by being asymptomatic. You don't know that there's anything going on. So you say, oh, I feel okay, so let me go see her. Practice those safe methods, keeping your distance, the hugging, the rest. Blow a kiss to one another.
That's why, you know, this whole idea of temperature checks at the job and symptom checks, we don't know how safe that really is, because asymptomatic people can give it to you. That's why these new reopening guidelines for offices for people who can't work from home are, you know, not just masks, but also you're supposed to be 6 feet away. And now they're barely starting to talk about this, but I think it's going to be a much bigger conversation about getting fresh air into those buildings. Ventilation, literally, you know, fresh, clean air, and getting the, you know, air full of these particles out. This article that I'm quoting is from a professor of biology who specializes in immunology at the University of Massachusetts, Dartmouth. I always like to quote my sources. And he also points out, okay, so that a lot of people are actually getting sick at home, or we're worried about grocery stores, and we're, you know, breathing and hugging up on people at home. That the bathrooms, probably public bathrooms, are more dangerous than grocery stores or a lot of the other places that we think about, you know, restaurants, standing in line. You're better off if you can wait to go home to go to the bathroom.
Well, you want to do, you know, individual health and public health are the most important. You want to just be mindful and pay attention to what's going on. And one of my greatest fears is that as we reopen, people get lax in terms of paying attention. Oh, they'll grab a doorknob, or they'll even grabbing a bag of chips out of the store, which you shouldn't be doing, but you grab a bag of chips. You don't know what's going on there. So to be aware. Now, there's also a fine point where you don't want to pass over where you're doing just too much. I'm seeing a lot of my patients coming in because they've been washing their hands so much, and they've been using their hand sanitizer that they're breaking out. Their skin is literally splitting because it's so dry, it hasn't been able to hold any moisture. After you wash your hands or you use a hand sanitizer, you must moisturize your skin. You're taking things out, even from the ones that say, the hand sanitizers that say that they have no alcohol. You're removing oil, which helps that protective barrier of your skin, and that's why it's breaking down. And there's no reason to scrub your skin, period. But there's no reason to scrub, especially your hand, on a daily basis. You do enough in just washing that to take off some of the dead skin cells that are there. So don't add to it by using a hand sanitizer and a brush and a rough scrub on your hand. Unnecessary.
All right, let's go to Pam calling us from Los Angeles. Good morning, Pam.
Good morning.
You're on the radio. Go ahead, please.
Yes, doctor, I would like to know what are the best treatments for neuralgia.
I'm sorry, Dominic, could you...
She's asking about neuralgia.
Neuralgia?
What are the best treatments for it?
The best treatment for neuralgia, I would tell you to go see a specialist, a neurologist, in that. There are several different reasons for it. It can be nerve damage. It could be diabetes. There are literally many, many reasons for it. Where it's at, how long it's been there. what your general overall health is. So the best thing would be, if you have the ability, the access to get to a neurologist, tell your primary care doctor, or take a look yourself. In terms of finding someone who's a specialist in neurology, so they can pinpoint what the source is of why you're having the problem.
All right, Pam, good luck to you with that. And, a lot of people are treating remotely, so that's an option. Queen Sakara from Long Beach, you have the mic. Welcome, Queen.
Yes, thank you very much. And on behalf of Queens of the Now, I would like to wish Stevie Wonder a very happy birthday, because he's such a legendary leader in our community who has definitely walked in the footsteps of great kings over history. And I wanted to just share that we first met Stevie when Queens of the Now was introduced to Queen of Soul, Aretha Franklin, in 1982 for the Brotherhood Crusade, and we have a beautiful
wow
from then. Yes, and we were so excited about it because we informed him we had staged our production to his symphony orchestra score, Secret Life of Plants, that revealed actually the secret life of our ancient world heritage, the great queens and kings of Africa. And we were seeking approval to use the score to introduce it to school children, and we were approved through John Paul. So for the last 40 years, we've had the honor of introducing thousands of K-12 school children and HBCU students, especially the queens. We've been able to present it at the King Tut exhibit, the Olympics, Cultural Olympiad, the African Marketplace, and on tours back and forth to the Great Pyramids in Egypt with the Association for the Study of Classical African Civilizations. And as you know, Dominique, when we opened our show at the Pyramid at Cal State Long Beach, you and the other angels and Steve Harvey came out and broadcasted live as the children, 5,000 children, were arriving during school hours to be able to hear this music and see this production live. So this year is our anniversary. We wanted to plan some type of tribute to you, Stevie, and record a listening CD for school children where they hear the symphony and epic poetry from the production. So we're looking forward to being in contact with you. Definitely, once again, it's been our honor to be able to preserve this music, because many times our African-American and Black musicians, they get pegged into one category. And when they start to move out into broaden their work, they're not allowed to, and people are confused. But we have found it to be just an incredible piece, and we want to see that this is preserved for generations to come.
Oh, right. That's excellent, Queen Sakara. That is the essence of radio freedom. We don't have to be put in a box. We can play any music. We can be in any genre. And certainly Stevie Wonder, the birthday man, is a great example of that. And thank you for your work, Queen. We are going to be back. More of your tributes to the great Stevie Wonder on his birthday. More questions for Dr. Paul Wallace on a Wellness Wednesday. The doctor is in. It is Everyday Wellness. It's Radio Free 102.3 KJLH and KJLHradio.com.